PMDD, or Premenstrual Dysphoric disorder, is a condition in which a woman experiences physical and behavioral symptoms more severe than those with PMS. Some of these symptoms are severe depression, anxiety, and constant irritability. Similar to those with PMS, the symptoms occur a week before menstrual bleeding and usually disappear or lessen in severity a few days after their period begins. Here is a list of possible symptoms your client may experience. There's no single cause for premenstrual dysphoric disorder. It can be a mix of chemicals in one's brain and hormones in one's body, as well as other factors such as alcohol or substance abuse, weight, family medical history, and poor lifestyle. Currently, there's no physical exam, lab test, or standardized test that can diagnose PMDD. However, it is possible to rule out other diagnoses with a symptom tracker such as our PMDD test template. The test is for anyone who thinks that answering it may help explain the symptoms they are experiencing. Medical practitioners who may use this as a base or additional resource and benefit from it are gynecologists, physician's assistants, primary care doctors, nurse practitioners, mental health physicians, and endocrinologists. To use our free PMDD test, follow these steps. Download our PMDD test from the Carepatron platform, which you can find in the link in the description. During the initial consultation, you may conduct a short interview to partially fill out the template. We've provided guide questions to help you gather information regarding their diet, lifestyle, and medical history. Once you've finished with your interview, you may give the template to your patient and give the following instructions. Under the symptom checklist, tick the symptoms you are experiencing, whether that's mild or severe. Proceed to the symptom chart and write down the start date. Write down the symptoms you checked previously under the symptom column. Track your symptoms as soon as your period begins. Score them according to the scoring guide provided. Do this every day. After you've filled out the table, set another consultation appointment to go over the results. Each number in the symptom scoring table is equivalent to a certain pain severity. To score, simply choose the number equivalent to the pain level you're experiencing per symptom and write it down on the symptom row and the corresponding day. Here is a sample of our PMDD test, which you can find on our Carepatron platform. To find our PMDD test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.